think for a long time I focused on the things that I could not do. I started to live the life of a blind person. I had a caseworker that came to my house every week, and I was learning to use a white cane and had a talking book machine, and just this attitude that I couldn't do stuff. And I was really shutting myself down to a lot of possibility. And then I eventually just changed my mind and said, no, I'm gonna make art. I'm gonna learn to ride a bike. I'm gonna do all these things that I'm told that I can't do. And the number one person that was telling myself that I couldn't do them was me. My name is Morgan Andrews. I have an eye disease called cone rod dystrophy version 5, or cord 5. And it's similar to macular degeneration. It's in the same family of diseases called Stargardt's disease. I think it sets me up for doing impossible things, doing handstands and defying gravity and making art and struggling a little bit, you know, doing things that aren't necessarily going to make me a lot of money. Because it's a challenge. How little can I live off of? But the real wealth here is not a monetary wealth, it's a community wealth. It's not a thing that can be measured by numbers in a bank account. It's in the heart, it's in the air, it's around us. And it's great having folks like Corbin and Ellen around who understand that and understand that they can contribute to that community wealth. Let's just work on my eyes. That'd be good.
Vision stuff more than pain or irritation, or?
I'm wearing a new set of contact lenses, so actually I've had some strain just because of the adjustment to the prescription. But really, you know, any...
Are you wearing contacts right now?
Yeah, I wear them all the time.
Yeah.
Did you know that?
I don't think I did.
You didn't think you did? Yeah. Sometimes I walk around without them,
Right.
and early in the morning, but usually not.
How's your sleep? I remember last time you were talking about the lessons.
My sleep schedule has been really wacky.
But that's more because of your life.
Yeah, more because of my life. It's not...
Because you can't sleep.
It's not because I have no trouble sleeping. I started going to treatments every week. Largely for my eyes. I've tried a lot of things over the years to help that, well, to prevent it from progressing further and to also heal from it somewhat. And acupuncture was a thing I hadn't really tried before extensively because it was so expensive everywhere I went. And it was great to be able to go to this place where it was someone that I knew and trusted administering the treatments. And it was also affordable enough for me to go every week and see some actual results.
How much would you like to pay today?
15.
Sounds great.
The sliding scale for me allows me to get the acupuncture in the way it is meant to be given as a treatment. Prior to coming to Philadelphia Community Acupuncture, I was only able to afford once a month because it was very expensive. And, you know, I'm self-insured. I pay cash even for my medical because I'm, you know, self-employed. So having a sliding scale allows you to get the treatment that you want to allow your body to heal itself and on regular intervals. Not that coming once a month didn't help me, but this keeps me like with a tune-up. I'm fine-tuned. It doesn't give a chance for me to get unbalanced. I got 7 days, and then I'm back here.
Do you live in Philly or Jersey? If it wasn't for the sliding scale that fit my budget, it would be impossible to take the number of treatments that would allow me to get better. I would, if I had to pay average prices, I would pay to get better, to wait to get sick, to pay to get better, to wait to get sick, just over and over and over.
I think it's the best thing that ever has happened as far as wellness is concerned, to have this sliding scale where it is affordable. It's not so painful to do it financially. And I think the spirit is right.
The moment that I decided to try to figure out how to treat people in this style was when I was in New Orleans treating people after Katrina. It made sense to just treat people wherever it was available, which ended up being street corners, health clinics, in parks, and it also made sense to just treat people in groups, basically a circle of chairs, treating people with very simple treatments. And I realized I loved doing that, and it made it so that a lot of people could get acupuncture at once, and it was cheap. And so I kind of told myself at that point I never want to treat people individually again, but I had no idea how to do that and make money.
And I had been working in a pain management clinic doing acupuncture and treating 4 people an hour, and realized I could do that. Realized, oh wow, I don't have to do it the way they told me at school. It's not that hard. I can treat more people an hour than just 1 or 2. The fact that Lisa wrote the remedy, that we had that, that was like, okay, there's a blueprint. Here it is. This is how it's done. I used that to write our business plan, basically. I signed up on Can immediately and sent Skip an email, and he shot me back an email telling me about Corbin's post, saying that he needed a partner, which I checked out immediately and was like, yay!
My name is Muhammad Abdul Bassett. Around 2002, I was diagnosed with leukemia. It was actually on my best friend's birthday that I went into the hospital and I was diagnosed. I spent my 16th birthday in there also, so I was in there for about a month. 8 years later, I'm in remission. The leukemia is all gone, but at the same time, I'm still going to acupuncture to help keep me healed. Because there's no guarantee that, the cancer is all the way gone. The doctors may miss something in your blood test or something like that, but I've been going to acupuncture for about 2 years and I haven't had any problems.
You still on anything, meds?
Antibiotics, pain meds. But like I said, I have the appointment tomorrow. So
How often do you go do that?
whenever I need it.
Okay.
So
Okay.
my last appointment was April. So
Okay.
yeah.
Wow. That's cool.
For the past about 5 years, I had something called hidradenitis, which basically it's a skin condition that causes like open wounds. I was going to doctors for years, and they didn't really have an answer for me. They basically told me there's no cure for it. So my sister, she actually started going to acupuncture. Then she told me about it. I started going, and it worked way better than medicine. Any antibiotic you can name, I was on it. I was on all types of pain medicine, oxycodone, tramadol, all types of stuff. But yeah, it worked. It was like magic. Like things happen for a reason. I had leukemia for a reason. I got hidradenitis for a reason. If I didn't have the hidradenitis, I would still be working at Walgreens, and I wouldn't have got the disability money, which allowed me to take off from work and actually focus on the clothing line and focus on my health. If my sister didn't go to acupuncture, I wouldn't have been introduced to it. So it's looking back, it's like, wow. We have a clothing line called Jean Tricks. We make all types of crazy stuff. We started out with a pair of sneakers, and it ended up being stuff like this, and it feels like a part of you is going into the clothes. You have to put love into everything you do. It's a great feeling because it's one of my passions. So it's really incredible that I can create things that weren't there before and that people actually like and buy. It's a great feeling. it almost seems like impossible that you can put needles in you and you can be healed. Like, that's kind of impossible for somebody that's closed-minded. Yeah. And our big thing is staying positive and sticking to your dreams and your passions and doing what you want in life and just be happy.
Went out, had my food.
Yeah.
Yeah.
Yay.
Had champagne.
Yay.
Yeah.
One
Didn't
glass.
get sick.
Yay.
2.
2 glasses. That's great.
Tonight's big night. We're gonna try mac and cheese after this one.
Sweet.
I'm Dara Therese. I started out with gastroparesis. I did everything humanly possible. I was having surgery every 3 months, so that was really convenient for my life. I started looking for alternative therapies. The medication was making me sick. It was a second full-time job just to take care of the disease. It's actually stomach paralysis. My stomach doesn't move at all. So it really ticked one day and decided I was going to throw out all of my medication and everything else and try something different. So I started with acupuncture, chiropractic, different types of exercise, and food. And that's how I ended up here with Ellen. Ellen said give it like 10 treatments. She said give it a minute, see how it goes. I really didn't think it would work at all. I'd been through the ringer my whole life without even really knowing I was sick and spent the last 3 years in and out of anesthesia. So I was like, really? Little needles? Sure, whatever. After the first treatment, I felt so good. I went home and called my grandma, my mom, my ex-boyfriend, my friends. I couldn't even sleep. I was ecstatic. And I ate pasta for the first time in like 6 months and didn't get sick. I actually have a life now. I go out with my friends. I can have a glass of wine if I want to. It's fabulous. And I especially didn't expect it to work that fast. I couldn't believe that I actually got results. There's no anesthesia. I can plan my life. If I want to, I can go travel to other places in the world now where acupuncture is available. I can have kids if I want. So it's opened up a lot of possibility that I didn't necessarily think I was going to get. And I even get to go back to school now because I have enough energy to do it. So who knows, I may end up studying a little bit of acupuncture with the diagnostic medicine I'm studying.
I mean, when we both graduated from acupuncture school, we had really no idea of what we were going to do. I mean, basically the deal with acupuncture is you can charge a lot of money and you treat really rich people, or you can have these public health jobs for folks, you know, where you serve folks who are really mostly indigent, you know, dealing with really hardcore problems. But there was nothing sort of in the middle for people who, you know, have relatively stable lives, but not a lot of money. Working poor, working class, lower middle class, just kind of, I mean, what to me was average people. There was absolutely no room in acupuncture for that. But really all we wanted always was to be able to serve the community that we're part of.
Right.
We didn't want anything more complicated than that.
To serve our neighborhood, where we live.
Where we
could afford to live.
Where we could afford to live.
There's so much that we didn't know, and we're still learning about a lot of stuff. I mean, we found that, well, you know, if you look at the population of not just this neighborhood, but the country, there's a lot more people who are working class than there are ridiculously rich.
Or indigent people. I mean, it's the enormous middle.
So we found this big market that was just completely neglected by acupuncture, of people who go through their lives in pain. Right. And we do help.
Since I got retired, this is what I do now. I used to work heavy construction. I'm Gary Guzman. They call me Goose most of the time. 65 years old now. It will be in May anyway. Acupuncture, started going to India. It was kind of a last-ditch effort for some things that were bothering me. My back, I've had from some crushed disc from just work and through life and motorcycle accidents and stuff. I've had a pain there for 25 plus years that ran from one side of my back all the way across, about the size of my fist and then across. And I noticed that went away, basically. And that in itself was amazing to me. And so I kept going. I've been going quite a while and seeing results. I don't cough up any more blood in the wintertime and the bad weather. And I don't have the nagging cough I had all the time, and that was from the asbestos because of my lungs. That's gone. The urge is pretty well gone now to cough all the time. My regular doctor I go because of the meds I take because I got asbestos. I have to take meds, and they're pretty hard on you. So he does a blood workup every 3 months. About the last year, he notices my readings have really improved. I'm the best I've been probably in 15 years now. We talked about it, and he said, well, whatever you're doing, just keep doing it. So I keep doing it, and it works. It works for me anyway. It's helped, like I said, a lot on the pain and that, shoulders, back, and stuff. So it's given me the ability to get around and just enjoy things. I've got a grandson that I'm quite active with that it allows me to go places and do things with him I probably wouldn't do otherwise.
We came up with the great idea that if we, instead of charging the going rate of $60 a treatment, that we could treat 4 people at the same time, or $15,
each,
and we'd still make just as much money.
60 divided by 4
and
is
we
15.
could survive.
It was brilliant.
You know, you walk into this room filled with strangers. You don't talk to each other. You don't make eye contact, but you're all there for a similar purpose, which is to try to heal something that's wrong with you. And I'm going to venture to guess that most of those people couldn't afford the care that they're receiving if it wasn't for the sliding scale. I absolutely wouldn't be getting the treatment that I'm getting now if I was paying the going rate for an acupuncturist treating a patient one-on-one. This year, I had a traumatic event that kind of triggered the anxiety in a way that I've really never experienced, and that's related to an attack when I was a teenager and finding out that the person that attacked me was going to be paroled. I could barely leave the house. For me, a successful day was getting my kid onto the bus and off to school, and then I was done. I saw my doctor, I got medication. Didn't really solve the problem, which was that I couldn't function in the midst of a 24-hour-long panic attack because the drugs made me even less functional. So I went back to Lisa at working class acupuncture. I told her what was going on, which was really difficult. It was hard for me to talk to anyone about what was going on. And she immediately offered to treat me as frequently as I felt I needed, set up a payment plan with me because I needed so much more treatment than I could pay for at once. She popped the needles in and I fell asleep, which is still amazing to me that I was able to do that. I'm the parent of a handsome, sweet, bright young boy, 9-year-old boy, who happens to have a pretty severe disability. A lot of my stress around that isn't a direct result of my kid, but the various kind of systems that I have to navigate on his behalf and just prevailing attitudes towards people with disabilities
and perhaps the fact that this world just wasn't really made for a kid getting around on wheels. For several years, I have not been taking care of myself as I've been advocating for my son and as well as other people. I do disability advocacy. The effects that the acupuncture has on me obviously is going to affect every aspect of my life, and it definitely helps me deal with some of the stresses related to parenting and just have a greater sense of well-being. I've done years of talk therapy. I've tried medication. I write, I've done any number of things to try to deal with my anxiety levels and to process my traumatic experiences, and I've never gotten this far, period, but to get this far in this short of time is amazing to me.
The best way to get people to do acupuncture is to get them to do acupuncture. They need to get needled. They have to try it. And so you've got to make it so that as few barriers as possible are up to have people come in to get needled. And it's not so much advertising as such, but being in the place and making it so that people can't say no. So at least trying, at least some people and some families just doing that. You give a free day to anyone who comes in, free acupuncture that day. You just got to get people, things like that. You just got to get people to try it. And then they tell their friends this really worked, or their families, and things like that happen. And then slowly you build up credibility in the neighborhood. We get a lot of our people now are people who come to us new, who, when we ask them how they find us about us, they've been driving by us for years. And they've been meaning to stop by, but now they whatever's going on with them is enough that, okay, I'm going to try it. And that's how we get them. And then they bring in their families because they really like it and all. So it's a very gradual, you got to become, since acupuncture is weird, you've got to show yourself as being part of the community that you're in. And that's what we've been able to do. Just gradually over time, we get more and more people. And now we see about 460 people a week who come in to 500.
Yeah, when we started, I had just moved my practice out of my house, and so we were seeing maybe doing like 12 visits a week, and in 8 years, 12 to 450, 500. Like, we had no idea that was possible. Nobody had any idea that was possible. And everybody said when we started, oh, that won't work. People don't want affordable acupuncture. Working class people don't want acupuncture. I've heard that so many times. It's totally not true, but you can't disprove it in theory. You can only disprove it in practice.
Right. And it's kind of neat seeing the people that come in, especially, someone comes in, say, on a free day, and they like it, and they keep coming back. And then they naturally want to tell their friends and their family what it is. And it's fun to see, like, whole families coming in together, or, couples coming in together as, like, their date for the week. Or, and just seeing the lines of just seeing various people, like, say, Gary has brought us maybe 50 other people, family and friends. And then we've got other people like that who are just really good at attracting people. There's people who are like patriarchs and matriarchs, even though they're not called that in our society, but they really are. People listen to them, and they come in. And so it's really cool seeing those people. We have enough people now that we have several of those types, and that's a lot of fun.
As we're walking around, I'm thinking of all the houses we're passing where our patients
Yes,
live.
right, yeah, right. We've passed several patients'
A whole bunch.
houses. Yeah, we walk this way to the park normally also, and we always.
And people come up
Oh,
to us.
hey, how you doing?
We could knock on some of their doors and see if they'd talk to us.
Well, my name is Nancy Hunt. I've always believed in a holistic approach toward especially good health, and I've been having a lot of medical problems recently in the last several months. concerning arthritis and inflammation of my rib cage. And after seeing several doctors and having several medical tests and taking medication that I was having bad reactions to, I decided that perhaps acupuncture might be a solution. And I talked with Lisa at Working Class Acupuncture, and we kind of agreed on a treatment program. And so for the last month, I have had acupuncture treatments twice a week, and I see a tremendous improvement in my health, both with the struggle with arthritis and the pain accompanying it, and the inflammation in my chest cavity. I'm not having to take medication for pain as I was taking. That's been the biggest boon to me, and I just feel like not only has it helped me medically and physically, there's kind of a spiritual component as well. Working Class Acupuncture reminds me of a place where you can just go, and as soon as you enter the doors, it's like going to a different world, peaceful and serene. Lends itself to an atmosphere of quietness, and almost like it's very prayerful there. So I would certainly recommend it to anyone. In fact, I've been doing that.
Our problem now is we're dealing with problems of growth. Like, we had no idea we could get this big. We had no, we started out just really trying to survive ourselves and fit our vocation, which is acupuncture, into the rest of our lives, into our neighborhood, and like trying to do that for ourselves and starting this little practice. And now we have 20 employees. Like, we don't know how to do that. We're trying to learn, and but it's clear the more we do this and the more other people do it around the country, it's clear, that working class, lower middle class people, whatever, people without a lot of resources do in fact want acupuncture. They love acupuncture. There's enormous, there's enormous need for it. There's enormous interest in it, and just trying to figure out how to meet the need with the resources we've got. I'd say that's our challenge. The need's bigger than we thought it was.
I'm having so many difficulties, like finding an employee, and there's so much need where I am. I mean, you don't understand, like, retired farmers drive like an hour and a half from like the middle of nowhere to come see me. We are the only community acupuncture clinic in all of Tennessee. We're the only community acupuncture clinic in many surrounding states as well. So we have patients drive from other states to get acupuncture. People are like, oh, can you come to Caledonia an hour, a week or something? I can't be like 7 places at once. And there's so much need in Minnesota, and Wisconsin, so many towns and cities that are lacking in acupuncture that have tons of people that need it.
The People's Organization of Community Acupuncture is a multi-stakeholder cooperative. It's a way of taking control of the economic foundation of something that you need when sort of normal capitalism isn't going to provide it for you. It's a way of organizing people to make something available to them that they couldn't otherwise get.
There are different levels of membership. So for an average person coming to a community acupuncture clinic, there's an opportunity to buy in, to become a member, plug some capital into the organization in exchange for certain member benefits. Same goes for acupuncturists, acupuncture students, same goes for clinics.
Our mission is to further the growth of the community acupuncture movement, opening more clinics, expanding the opportunities for sustainable living wage jobs for acupuncturists. I won't have to tell patients You have to drive 2 hours to get affordable acupuncture each way because an affordable acupuncture clinic opened in their community. POCA's going to make that happen more quickly than if we just relied on what we're doing now.
Somebody asks me, oh, is there a clinic in Grand Rapids I can send my aunt to? I can say no, but she can join this organization, and eventually we'll notice that there are 20 people in Grand Rapids that want community acupuncture, and they can figure out, a way to get together to either start a clinic themselves or, in some way recruit an acupuncturist to serve them.
And then patients don't have to drive 2 hours to get acupuncture. They can walk down the street to get acupuncture.
There aren't really that many acupuncturists, especially in places like the Midwest or rural areas. There are a lot of acupuncturists on the coast, but there aren't a lot in the South. There are some states that only have a handful of them. So we need a way to get people into the profession who are coming from communities that they want to serve that are not currently being served. So that means both geographically, and that means in terms of what kind of people become acupuncturists. That's a big thing. I think one of the difficulties for me was realizing that there weren't a lot of people like me who became acupuncturists. There weren't a lot of people from working class backgrounds, working class families who wanted to treat working class people.
I have what I call the acupuncture mortgage. I have over $100,000 in student loan debt, which is embarrassing. I feel like I've kind of ruined my financial future.
I don't know that I'll ever pay off my student loans, and I just don't. And also, there are people that would be great acupuncturists that have, their partners have jobs, they have kids, they have other family obligations, parents that they're taking care of, they have their community. They can't pick up and move to wherever there's an actual school and live there for 4 years.
There's a kind of stereotype of who goes to acupuncture school, who would be comfortable in acupuncture school, and that doesn't necessarily look like the communities we want to serve. So we really need a way to get people to become licensed acupuncturists who reflect the communities that need acupuncture. We're looking at a bunch of different ways to solve that problem, and we need to be really creative. We both need to be creative in terms of the geographical aspect. It would be great if we could incorporate distance learning so that someone wouldn't have to, say, leave the Midwest or the South and relocate to a coast to go to acupuncture school. We absolutely need to tackle the economic barrier, and so we're trying to be very creative about ideas and structures that would genuinely make a path to licensure affordable for lots of different kinds of people from lots of different communities. And this is a problem we have to solve eventually. We'll do what it takes.
The educational product that I was sold in school was not what I thought it was going to be, and it wasn't what was sold to me, just feel like it was kind of dishonest.
Creating a curriculum based out of the values that are important to us as community acupuncturists, with an eye on social justice, with an eye on communicating honestly with folks, removing much of the hierarchy that's in place in traditional medical systems that acupuncture schools have glommed onto.
Creating the new program, something that actually meets the needs of what we need as acupuncturists.
If this could happen and somebody could walk out of school with way less debt, I think that it could really change the future of acupuncture.
CAN was really great, being able to provide mentorship to me, and I wouldn't have been able to get where I am today without it. So I'm really excited about POCA being able to take things a little bit farther.